Dr. Helena Vaki, Associate Professor, Department of International and Strategic Studies at University Malaya, now joins me online to discuss transboundary haze and its impacts on the Malaysian economy. Hi, Dr. Helena. Thank you so much for making time for us. Let's get started. Dr. Helena, now after 4 years of sufficient rainfall and the return of El Nino, how prepared is Malaysia and the region to face another haze event in the coming months?
Yeah, good morning, Tamina. Thank you for having me. So there's definitely been a few good years, but I don't think that means that Malaysia has forgotten how to handle the haze. Haze has been a regular problem, as you said, for many decades, so there's already systems in place. But I think there are some things that we can further improve. One of the things that we've been doing some research into is to see how improvement of communication with the public can be further improved. So, for example, the public needs to know what to do when there is haze. And this shouldn't happen only when the haze is coming next week or tomorrow, but it should be something consistent. So throughout the year, there should be consistent communication about what you can do to protect yourself in terms of health, and also what you can do to not be part of the problem as well.
Yeah. Absolutely. I think you make a great point over there about us not taking emergency measures when the haze is already in the air. And we've also seen just how far-reaching such transboundary haze is with the current news updates coming out of New York as well, which is actually suffering from burning happening hundreds of miles away in Canada, right? So moving along, Dr. Helena. Now, since the last major haze event in 2019, could you take a little bit of time here to explain to us what kind of preventive measures have been put in place to prevent a repeat of regional haze incidents? In particular, I wanted to ask you about the AATHP, or the ASEAN Agreement on Transboundary Haze Pollution. Have you noticed or observed from your research and work any significant impact since its inception in 2003?
Yeah, so the ASEAN Agreement on Transboundary Haze has been in force for about 2 decades now. The academic community has been doing a lot of analysis about whether it's been effective or not. And one of the interesting things that has happened recently or lately is that there was an ASEAN Haze roadmap. And this roadmap was meant to operationalize and meant to do a stocktake of the progress of the agreement. So a lot of conversation about the agreement not really being very strong, a bit toothless. So the ASEAN has actually put into place this roadmap. And I was involved in the final report of the roadmap, which was supposed to run from 2016 to 2020. And we did find that there has been some good progress in some areas. So, for example, like capacity building, there's been a lot of cooperation across countries to teach each other best practices and also information sharing. So that's been really good. And that's been a clear result of the agreement. However, we did highlight a few areas which we think should be further improved, should be focused on for actually the phase 2 of the ASEAN Haze Roadmap, if we want to achieve this goal of a haze-free ASEAN. So the first thing I would like to highlight is the need for a uniform air quality index across ASEAN. So we do have an ASEAN Specialized Meteorological Center, which is the centralized area to kind of coordinate all the reports and the predictions. But all of the ASEAN countries still monitor air quality on a national level and base their alerts on their national methodologies. So because they all follow their national methodologies, the air quality index can really differ quite dramatically. So, for example, between Singapore and JB, right next to each other, but you would have air quality index which are drastically different. This gives a very confusing message to the public.
Soraya, ada online
uncertainty. And so I would say that a uniform index would be really helpful to make cooperation and coordination across ASEAN easier. The second thing that I think we should really look into is the need for a haze coordination center. So similar to ASEAN, ASEAN has a coordination center for humanitarian disaster, which is called the AHA Center. And this has been something that's been going on for a long time. The ASEAN Haze Center was put in place, the requirement for it was put into place during the agreement, but has not been actually existing yet. So it's really important for us to push forward on this so that we have a dedicated center in ASEAN to really address the haze issues and coordinate for the region.
Thank you for that, sharing that, Dr. Helena. Truly important for us to coordinate efforts so that everything happens in a consolidated manner. Moving along deeper into the next area, Dr. Helena. Now, haze impacts the lives of average Malaysians. Breathing and health issues for school-going children, working Malaysians, those who are medically vulnerable, to, of course, wider industrial disruptions in the local and regional economy. This includes aviation, tourism, agriculture. What public policy mechanisms, in your opinion, can be most effective in preventing yet another major haze event from occurring?
Okay, so for Malaysia's side, it's really important for the government to promote responsible corporate behavior among Malaysian companies, regardless where they're operating. So, for example, we always hear when there is haze, Indonesia will say that Malaysian companies are among those identified as being linked to the forest fires in Indonesia. And this can become a problem because it will become a source of diplomatic spats. It will make it difficult for our government to communicate and coordinate in a cordial manner with Indonesia. So there's definitely been great improvement since the early days of the haze, where companies would intentionally burn land. I believe this is very rarely happening now. But it's still important for the Malaysian government to develop mechanisms to monitor and cross-check Malaysian companies' practices, even when abroad. So currently, we don't really have such cross-jurisdictional practices in place. So it's basically sort of our word against theirs. The intention does not necessarily need to be to catch out these companies, but we need to have a system whereby Malaysia can confidently verify and ensure that Malaysian companies are not contributing to the problem. And this way, we can move forward more effectively with actually proceeding to solve the problem in a coordinated manner.
Absolutely. Malaysian first, and then, of course, we can also have a better consolidated opinion on how regional partners are also working within the same arena. One last area, Dr. Helena, and now any policy lessons from the COVID-19 pandemic experience that could be effective in the event of another haze crisis, which is also, in a sense, a public health emergency, considering the number of people who are not only take ill, but are forced to stay indoors, and, of course, the wider economic impacts.
Yeah, so definitely the COVID-19 experience is definitely something we can learn from. A good first lesson to be applied is the supply of masks. So during COVID-19, the government was quite good in ensuring that our mask supplies were adequate and also, importantly, reasonably priced. So for haze, the correct mask to use is the N95 mask, and this is the type of mask we can filter out the tiny particles of haze. But this kind of masks are more expensive than the surgical masks. So in past haze events, there's been N95 shortages as well as overpricing of this mask. So it's important now that the government can apply similar measures to what they used during COVID to avoid this kind of shortages or price hikes to happen again. The second thing is that just like COVID, during haze, one of the strategies is to get students and also working adults to work from home. So we do have, the COVID experience has taught us and prepared us how to work from home and how to study from home. These systems were, I think, pretty well implemented during COVID. So now we see that most government and private offices and schools already have these systems in place. So I think in a future haze event, if we do have something really serious, hopefully there will be less concern, less hesitation if haze emergencies are required to be declared in the interest of public health. So because of this, hopefully we will have less or minimal disruption to our work as well as to our studies.
Thank you very much, Dr. Helena. Very insightful. And now it's time for a quick break. Stay with us, though, and we'll be right back here with Niaga Spotlight.